So the plans are coming together, but there are priorities within the priorities. Here at Swedish and Edmonds, they're working out the final details on how the rest of their staff is going to get the vaccine, as we're expecting more vaccines to begin arriving. Swedish releasing photos of some of their first vaccine recipients from last night. Today, the first vaccines were administered at Children's Hospital. Yesterday, it was UW Medicine, which ran through their first batch on Tuesday, but won't begin regular vaccine administration until tomorrow. The idea is that when an employee's work week ends, and if there are side effects, it's hoped they will recover and be fully up to speed by the start of their next work week. And next week, it's expected that Overlake and Bellevue will begin administering the vaccine. We put some questions to their chief medical officer, Dr. David Knopfler. Hospital workers fall into Group 1A, a top priority. But among that group, who goes first? He says those at risk of contracting the virus because they treat COVID patients and those who could face more severe consequences of getting COVID, say somebody over the age of 65. Those are the priority. What about first responders? He says we need to finish the planning to vaccinate first responders and providers that are not our employees. FedEx is expected to deliver more than 60,000 doses to Washington this week, most through SeaTac. And the shipments are expected to keep coming, with around 160,000 more of just the Pfizer vaccine by the end of the month, not to mention more than 180,000 Moderna doses if that vaccine is approved as expected. So there's been a lot of interest about, can my employer force me to take one of these vaccines, even if I work at a place like a hospital, where Dr. Knopfler says no, because these vaccines have been issued under an EUA, an emergency use authorization, and it being so new, that can't be compelled. But we could be hearing more on this in the days ahead. In Edmonds, Glenn Farley, King 5 News.